This morning, big cuts to the agencies dealing with issues from drug approvals to food recalls. President Donald Trump's administration is announcing more cuts to federal health agencies.
Health Secretary Robert F. Kennedy Jr. says the department will do more with less, but right now top health officials are concerned. ABC's Christian Cordero has the details from Washington.
Today, Health and Human Services Secretary Robert F. Kennedy Jr. is slashing his own department's workforce as he vows to make it leaner, cutting an additional 10,000 jobs on top of the 10,000 previous layoffs and buyouts.
This will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000.
Among the agencies affected, the Food and Drug Administration set to lose 3,500 employees, and the Centers for Disease Control and Prevention losing 2,400 workers. RFK Jr. will also narrow the CDC's focus on preparing for and responding to epidemics and outbreaks, shifting away from monitoring nationwide health trends, including chronic diseases, firearm injuries, and overdose deaths.
We're going to eliminate an entire alphabet soup of departments and agencies while preserving their core functions by merging them into a new organization called the Administration for a Healthy America, or AHA.
Experts, including Dr. Philip Huang, the top health official in Dallas, are adamant the cuts will impact care and prevention. He worries a reduced workforce in agencies like the CDC will take away crucial expertise that his community relies on.
These smaller health departments, they don't have many staff, and you make a small cut, and that takes away a considerable, percentage of their workforce and ability to respond to anything at all. And so the impact on the local rural areas are really, catastrophic.
Democrats on Capitol Hill are sounding the alarm, as are some Republicans. Senator Susan Collins of Maine called HHS a critical agency that has to be adequately staffed. Christian Cordero, ABC News, Washington.
These cuts come just 2 days after health officials say they're pulling back more than $11 billion in COVID-19 related funds for state and local public health departments. Health and Human Services says it will no longer waste taxpayer dollars on a pandemic it says is, quote, non-existent. The CDC has reported more than 8,000 COVID-related deaths so far this year and 1.2 million since the start of the pandemic. Letters on the job cuts were sent out to health departments around the country on Monday, and we've reached out to our local health departments to see how they could be impacted. Both Rock Island and Scott County say they have not yet received notice, but if they are impacted, Rock Island County says potentially $700,000 in grants would be affected. Scott County estimates it would lose $25,000. Rock Island says the loss of funds would not affect day-to-day operations, but would impact its ability to prepare for a similar pandemic.